Hello everyone, I am Dr. Siddhartha Mani, Consultant Interventional Cardiologist at R.N. Tagore Hospital, Mukundapur, Kolkata. Today I will be discussing with you about a very important topic, that is accurate blood pressure measurement at home with your home blood pressure machine. Now this is very important because hypertension, as we all know, is a very severe clinical condition which can lead to lot of complications in different organ systems. It can lead to heart diseases like heart failure, myocardial infarction or coronary artery disease. It can lead to hypertensive heart failure, or it can lead to certain other arrhythmias as well. Sometimes it can lead to renal artery disease, that is kidney failure. It can lead to brain strokes, both in the form of intracranial hemorrhage or in the form of infarct, brain infarct. It can lead to peripheral artery disease, different vascular diseases. So this is a clinical condition, this hypertension, which if prevented in proper time will save lot of mortality as well as morbidity in the patients. So why home blood pressure monitoring is important? This is because whenever a patient comes to our clinic and we measure the clinic blood pressure, we call it a clinic BP measurement, that can lead to error in measurement or falsely high blood pressure due to many reasons. The most important reason is a thing we call as white coat effect. What is white coat effect? When a patient visits a doctor due to certain anxiety related factors or due to certain increase in heartbeat related situations, there can be erroneously high BP, and this is called as white coat hypertension. Maybe the patient is not actually hypertensive. If you take proper BP measurement at home or in out of the clinic situations, that is not in a doctor's chamber, you may find that the patient is absolutely normal and the BP is not high. So this white coat hypertension is more and more prevalent nowadays with increasing anxiety, with increasing work stress, with increasing our busy schedule. And moreover, whenever a patient comes to our busy OPD, there are many steps which need to be followed before proper BP assessment, which we, the doctors or the nursing staff, should follow. But because of our busy OPD schedule, many a times we are not able to follow all these steps stringently. So that can lead to falsely high BP or erroneous results. That is why we focus more and more nowadays on home blood pressure monitoring. We have coined the term as home BP monitoring, and based on the home measured values, we can classify the patient as hypertensive or normotensive and accordingly treat the patient. So that is why we need to know the proper way of measuring blood pressure at home. So I will enumerate the steps carefully one by one, and you have to follow each of these steps while you are measuring your blood pressure at home. See, mostly the machines we use for blood pressure measurement in our chambers is this machine, which is called an aneroid BP machine. Now this machine the common people at home may not be able to measure this BP with this machine properly. So that is why at home we use digital BP machine, which is an automated BP recorder machine commonly available in all medicine and medicine shops, and this is not too costly as well. So this digital BP machine has a cuff, a tubing and a centralized system with a button which will automatically measure your BP. So first remember that whenever you are going for home blood pressure monitoring, you should not measure your BP just after getting up from sleep. So just arising from sleep, the blood pressure may vary. So at that time you should not measure your blood pressure. Next is, you should not have any heavy meals at least 2 hours before measurement. So just after a heavy lunch or a very heavy breakfast, for the next 2 hours you should not measure your BP, and in the last half an hour before blood pressure measurement you should not drink any tea, coffee, alcohol, or you should not smoke. This is very important. I mean any caffeine related products like chocolates or something which can stimulate your sympathetic system should not be taken within the last half an hour before measuring BP. Next is you should not do or perform any exercise or exertional activity half an hour before BP measurement. So for the last half an hour the patients should be at rest, in a resting state at home, and not doing any exertional activity. Next thing is the bladder should be empty. The patient should not have any urge to micturate or urinate during the measurement of BP. That can elevate your blood pressure. So the bladder should be empty, and then the patient should sit on a chair support with proper back rest. The chair the patient is sitting should have a back rest. The patient's legs should be lying on the floor. Properly, yes. And they should not sit crossed legs like this. That should not happen, because that will increase the BP. The patient should be in a stable resting situation like this with a back support chair, legs on the floor. And then the hand has to be kept on the table to English. Come forward. Like this. The angle should be more or less 45 degree. It should not be very close to your body. It should not be completely at 90 degrees. It should be at a almost 30 to 45 degree, supported on a table. It should not hang. Like many a times I find the blood pressure, the hand is hanging like this. It should not hang like this. It has to be rested on a table like this. The elbow has to rest on a table. The cuff you will wrap around the arm, the upper arm, that cuff has to be at the level of the heart, more or less. And now when you are taking the cuff, insert the cuff like this. This tube has to be in front of your elbow, this part. So you should not wrap it like this. This tube cannot go to the lateral part or to the medial part. It has to be just in front of the elbow. And then you have to wrap the cuff in such a way that it is not too tight, not too loose. So we say that you should introduce 1 or 2 fingers comfortably within the cuff. So maybe it is slightly tight, I am making it a little loose. I have to introduce 1 or 2 fingers. Now this looks normal. I am introducing 1 finger comfortably within the cuff. So that is the proper tightness. Now this cuff should not be wrapped high up over the elbow. It has to be 1 finger breadth or 2 finger breadths above the elbow. This is the elbow crease. This is the elbow crease. So just 1 finger breadth above the elbow crease it should be wrapped. So these are certain things, because if you wrap it here, the muscle bulk is more here. The BP will be falsely, I mean it will give you an erroneous result. If you tight it too much, that will again give you a falsely high BP. So this is about wrapping the cuff. Now you have to press the button. That is very easy. You will start, it will automatically measure the blood pressure. So you can see that this is the BP 114 by 62. You can see systolic and diastolic, and you can see the pulse. It is showing PUL pulse, that is 62 per minute. So it will give you both the pulse and BP recording. Now very important thing is, during BP measurement you should not talk, you should not watch TV or mobile. So this is very common nowadays, that the doctor is measuring BP and the person is talking over a mobile or talking with someone else or watching the mobile screen. So that will again give you a erroneous result. Another important thing is you should not rely on a single BP measurement. Whenever you are measuring BP, particularly in the clinic settings in our chambers, ideally we should measure 3 BP recordings at 1 minute interval. So I have measured once, I should give him a rest for 1 minute, then I have to measure again rest for 1 minute, and then measure again, and I have to make an average of these 3 recordings. That is the ideal. That is why I said in the beginning that in the busy schedule of our OPDs in our chambers, it is not often possible to measure blood pressure of each and every patient with this meticulous steps followed. So that is why the BP at home, this is possible to be measured by the patient himself at home. So that is why home blood pressure monitoring nowadays is gaining more and more importance. So that is how the average BP is recorded. And remember, BP is a thing which fluctuates. Many a times I find my patients asking that my morning BP was this, and then it became slightly high, then it became slightly low in the evening. So the patients are very anxious about that. But that is a normal phenomenon. BP varies with time, with meal status, whether you are measuring it before food or after food. BP varies whether you are measuring it after activity or before activity. With the duration of the day, that is morning or evening time, our hormone levels also vary, and that can lead to your fluctuation of the BP. So there is nothing to be worried about. The BP normally fluctuates. If the average BP recording is within range, that is if it is below 140/90, then your blood pressure is normal and you are not an hypertensive. Now, when you are measuring home blood pressure monitoring, you should have a morning measurement or daytime measurement, you should have a nighttime measurement or evening measurement, and you have to make a chart of this pulse and BP values over 7-day period, and you show this chart to your cardiologist, and accordingly they will classify you, or they can understand whether you are really a hypertensive, and accordingly the treatment will start. Now, regarding the causes, the different categories of hypertension, the complications of hypertension, which precautions are to be followed, the treatment, this I will discuss in a separate video. Today I am just discussing about the accurate steps of BP measurement. So that is in a nutshell about how you should measure your home blood pressure, and how you should take average of few recordings, how you should maintain your chart. And nowadays we all have a pulse oximeter at home, which you can easily measure the saturation. Like you make it on, you put a finger inside. Remember, while measuring a pulse oximeter, you should not have, particularly in the females, you should not have a nail polish. So that will give you a erroneous result. Your hand or finger should not be very cold, so that can again give you a erroneous result. So like that, you keep it, rest the finger on a support like a table or something. You can see the proper wave beats are coming, and it is showing a saturation of 98 and a pulse rate of 62. Remember, the pulse rate we measured in the BP machine was also 62, so it is perfectly accurate. The machine is perfectly calibrated, and so we can measure the saturation also. Another important thing that we see in this pulse oximeter, you can take a recording sometimes, that the pattern of the waves, that can give you some information which is not your subject, but your doctor can decipher some information with the pattern of the waves. So these are some additional informations. So nowadays, because as I said, because of the white coat hypertension effect, because of the chance of erroneous BP measurement in our busy outdoor schedule, it is very important to measure, to know proper home blood pressure monitoring. And another important thing is, due to the COVID situation, many of the patients are opting for teleconsultation. They are consulting us online, video consultation over phone, or from their houses or from distant places. So at that situation, if they can measure their blood pressure properly at home, pulse rate, saturation properly at home, and if they can convey that information to us, so it is very useful to us for giving or for prescribing proper dosages of medicines. So that is why I would recommend all of you, particularly those who have elderly people in their home, to have a home blood pressure machine, a digital machine which is not that costly. It costs around 3,000, 4,000 like that, and easily available, and more or less they are accurate. This is another question patients often ask, that are the recordings accurate? So I should tell you that yes, there sometimes is a 5 or 10% deviation from the aneroid value which we measure, but more or less it is accurate. It can detect hypertensive emergencies, like if you find a very high blood pressure 200 by something or 180 by something in a digital machine, so you will be able to understand that the patient is having a hypertensive urgency, and immediately you will go to the to your nearby center. So these are the benefits of having a home blood pressure monitoring, and if you follow these simple steps, I will enumerate the steps at the end of the video in a text format, so you can note them down also, and if you follow those steps, then I think you will have a proper BP assessment at home. So that's it. Have a proper BP measurement at home and treat your hypertension early and aggressively. Thank you.